Hello again everybody, Dr. Saccone here with MedCore Asthma and Pulmonary to give the third update on COVID-19. We've got some important topics to cover today. We'll talk to the current cases and mortality rate, are our efforts working, and where we are on the curve. Also, what is all this fuss about hydroxychloroquine and azithromycin? Are these really a cure? And also, there's some very encouraging news with regards to the prediction models. Okay, so let's talk numbers. As of today, March 26th, there are about 80,000 cases in the U.S. with 1,124 deaths. This conveys about a 1.4% mortality rate. Similarly, in New Jersey, there are about 6,800 cases with 81 deaths, conveying about a 1.2% mortality rate. Again, we're still in this range of 1 to 1.5% mortality rate. Despite the vast number of cases, we're not seeing a huge uptick in the percentage of people dying, but the total number of people dying are obviously increasing as this caseload increases. Now, this can change with a few major hospital centers becoming overwhelmed or with new outbreaks popping up in different areas, which is why we have all these protective measures, the social distancing, the quarantine, and everything else in place. So, are they working? Are we flattening the curve? I have encouraging news, but I have to give you a crash course on statistics. First things first, the absolute number of cases means very little, especially since we don't know of those patients that we're seeing how many have actually recovered, since the data isn't really being looked at. However, we are looking at three pieces of data: the number of new cases each day, the percent of the new cases increase each day, and the number of deaths. So, here are the statistics. I'll do my best to keep it clear, moreover brief, and try not to bore you too bad. To understand this, let's look at a hypothetical situation. The first scenario, there are 1,000 people infected. Each of these people infect one other person. So day one, there's 1,000 people, each infects one person. So the next day, there are 2,000 people infected, or 1,000 new cases. The next day, there are 4,000 people infected, with 2,000 new cases, and so on. This would be a percent increase of 100% daily and would lead to exponential infections. Now, let's look at the same 1,000 people infected. On day one, they each infect one person, 1,000 new cases, and now 2,000 people are infected. At this point, people start to socially distance, they start to quarantine, and instead of every person infecting one person, 3 out of every 4 people infect someone. So the following day, we see 1,500 new cases with 3,500 people totally infected, showing a percent increase of 75%. Now on day 1, there were 1,000 new cases. Day 2, 1,500 new cases. Despite the fact that there are more new cases on day 2 than day 1, the rate of increase is lower. So we can view the rate of increase as a transmission rate, really among the general public. We hope that as we continue to quarantine over the following days to weeks, we see only a 50% increase, then 40, 30, and so on, until that percent goes down to 0. The percent increase of new cases will be the first number to drop, even though the number of new cases will be larger than the day before. So let's look at real numbers. Here's my spreadsheet. You can see the number of new cases, the percent increase from one day to the next, and the number of new cases. The data is hard to interpret because we really don't start aggressively testing until last week. But when you look at the data, you can see that the percent increase of the new cases is starting to drop. It isn't clear if these are a function of the initial wave of testing just tapering off, or really exactly what, and there's still a significant number of new cases. But it seems, at first interpretation, all the hard work and self-sacrificing that we're doing is actually paying off. Now, if we remove the restrictions too soon, or people ignore the recommendations, we will have outbreaks and these numbers shoot back up. Now, if you're one of those people who is not practicing these measures, I want to reiterate, these numbers will go back up. If they go back up, the quarantines and restrictions will last longer. So suck it up, enjoy your time off from work, and don't invite friends over for a barbecue. You'll see the percent increase go down first. Then you'll see the number of new cases start to decrease. The last number to be lower than the day prior is the deaths per day, and that's because although the infection rate in cases may start to lower, those who are already infected are dying in the hospital, and this is going to be a lag time for this. But if these numbers trend in this direction, it is encouraging. It's tough to interpret these numbers because the U.S. is so vast. Maybe we see a decrease in cases in New Jersey, but then there's an outbreak in Wisconsin, so the numbers that were trending down everywhere suddenly bounce back up nationally. So we have to analyze these on a state-by-state basis as well as nationally. And New Jersey is currently following the same national curve. Now believe me, this is far from a cut-and-dry interpretation. In fact, my model last week grossly underestimated the predicted cases, but with more data, we'll get closer to pinpointing it soon. Now, The bad news. If we do continue to see a daily increase of 10,000 new cases, we will be running the risk of overwhelming our medical centers. We are starting to see this in New York City and the suburbs, North Jersey, as well as in Seattle. I said last week, I thought we might see this in these harder hit areas, and the hope being that we can start to shuffle patients, medical staff, and resources around to at least start to mitigate this. The full effects and stress on our medical system are still yet to be determined. However, hopefully we'll be able to weather this storm without too many centers becoming overburdened, and these case numbers will start to drop. It seems like we might be starting to level off, but even if we plateau, meaning a stable number of new daily cases, we might be at that plateau for a while, a few days to even a few weeks. These numbers may even bounce up and down should new outbreaks occur in other areas. This means the lockdown will continue, because even if we wrap things up in New Jersey, PA, and New York, but now we see an outbreak in Wilmington, Delaware, we can't stop these restrictions, because let's be honest, a virus does not abide by state lines. Now, on topics. What's the deal with hydroxychloroquine, aka Plaquenil? So, hydroxychloroquine is an old anti-malaria drug which also has benefits in autoimmune disorders like lupus, which really is what most people are using it for these days anyway. There was a small study of about 40 patients in which hydroxychloroquine and azithromycin were used in France, and it showed a 100% clearance rate of the virus. This seems very impressive and optimistic, and there have been subsequent reports that have been equally as optimistic, showing good data towards an effective treatment. Now, we need to dampen our enthusiasm. These are small studies, and even when dealing with something that we don't really understand to begin with, we can't hang our hats on a medicine that only anecdotally works, or maybe it only works on one strain, or maybe just in the population that was seen in France. It's too soon to jump all in. All medicines have side effects, and my adage is, if you don't get any benefit from the med, you're just putting yourself at the risk of the side effects. That being said, this is a cause for hope, but not celebration, and this is something that we are watching extremely close. Also, I'm going to say, these are reserved for ICU patients. Do not ask your doctor for a prescription unless you've already been taking it for other reasons. There is some use of some antiviral medications as well, which are showing some success, but again, it's too soon to tell. On the vaccine front, human trials have started, but especially for a vaccine which needs your body to generate a strong immune response, we won't see this available for at least 12 to 18 months, so we can't expect this to be the saving grace for the pandemic. The good news is that COVID-19 appears to be a dumb virus, meaning it's not adapting to the host, and at least present does not seem to be showing significant mutations, which means that once a vaccine is created, it's likely to last in our systems for a while. Now, this can change, but I'm going to keep providing you with as many unbiased facts as we can. Finally, hot off the presses, some very good news. The epidemiologic model quoted by many news outlets, which is called the Imperial model, had come out of UK. It had originally stated that if we did nothing, we would see 2.2 million deaths in the United States, and the UK would see 500,000 deaths. Many people, myself included, felt the virus had been around a lot longer, and probably many more people have already been infected. The producers of that model have just stated their initial projections were wrong and drastically revised this model. They're saying that it's very likely that many more people have already been infected and have recovered, so not only is the mortality rate significantly lower, but there are also less people to become infected. And they adjusted their model for the UK, saying that if nothing was done, instead of 500,000 people dying, only 20,000 will. They did not project for the US yet, but if the ratio were the same, we would see only 88,000 deaths, not the 2.2 million, if nothing was done. Still, 88,000 is awful, and we need to do everything we can to limit this amount. Now, this doesn't change anything yet, because this is only a model. But it is pointing out what a lot of people like myself have been suspecting, that the effects are hopefully going to be less devastating than initially projected. However, the same regulations are going to be in place. I will keep bringing you updates as they come out, and we will keep you posted on the latest developments. However, nothing has changed yet, so again, wash your hands, don't touch your face, wipe down common use areas if you're in the public, actually just avoid leaving your house altogether, maintain 6 feet distance, don't shake hands, high five, or hug, it's okay, we all understand. But by practicing these measures, abiding by your local and national government regulations, and taking the advice of healthcare workers, we can get through this. What we're doing is working. Millions of Americans' health, lives, and jobs are relying on you to do your part. Thanks for watching, have a great day, and God bless. If you like this video and would like to continue seeing more, please like, share, and follow us at MedCore Asthma and Pulmonary. The link is at the top of the page. Have a great day, stay healthy.